Hi everyone, welcome to my sweet office. We're remodeling our house right now, so my office is in the basement. I just wanted to give you guys some tips on the approach of your assessment, and then when making differential diagnoses, ordering labs, and plan. So first things first, approaching an assessment. So like I said before, um, your HPI and health history is going to be the most important thing. So using either they use Olcarts, which is one I do. That's in chapter 2 on how to ask questions about a complaint, and there's the other one that they use. I just think Olcarts is best. So onset, location, duration, characteristics, aggravating and relieving factors, um, temporal, and severity. Um, I just think that's the best way, and it's systematic, so you won't leave anything out. And then when you are approaching differential diagnoses and possible labs to draw, so when you have differential diagnoses, um, you are going to want to look up the guidelines, the official guidelines on each diagnosis, and the one that you're most likely to consider. Um, and use those guidelines to set the path of what you're going to do. So, for example, there's someone who comes in with a history of diabetes and they have a wound infection. The person tells you that they haven't taken their medication in 3 days. Miss Jones also reports that she's feeling thirsty and was told in the ER that her blood pressure and her blood sugar was high. So, what are we thinking about? We are seeing a 28-year-old woman with uncontrolled diabetes, high blood pressure, and a wound infection. She has a fever, she doesn't feel well, and there's pus, right? So, first of all, she's diabetic. Pull out the American Diabetes Association guidelines and the American College of Endocrinology guidelines. That's what everyone should have used in their paper. I saw a lot of really nice resources, and I definitely think the journal articles were great. The ones that were relevant, there were some that were at like after 2010. Even 2010 is still too old. Really, you need to use guidelines that are within papers that are within 5 years. But no one mentioned the ADA guidelines that are out there for providers. So make sure that you use things like that. It's just really important. So a few things. Some of you did mention repeating the x-ray. I think only one person did. And I was like, yes, ding, 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 because osteomyelitis, yes, it was ruled out in the ER. Great. However, remember she said the pus wasn't that bad in the ER, and now it is. And now she has a fever, and now she feels terrible. First of all, osteomyelitis, it's there one day, and then it's not. So you need to repeat that x-ray or get a CT. So that we can look into the soft tissue. And that's okay. This is part of learning that. So what type of imaging is best for a wound? And then for antibiotics. Now, only one of you actually named, no, two of you actually named the antibiotic of choice for a skin infection in a diabetic with penicillin allergy. So, depending on their penicillin allergy, you can use a cephalosporin unless she was having anaphylaxis. And clindamycin is also you can use because with diabetics, as stated in the guidelines, um, infections tend to be MRSA. So that's MRSA, methicillin-resistant Staph aureus. So you have to use things like clindamycin. Um, uh, and then what are the risks of clindamycin, right? C. diff. So just keeping that in mind. Now, when it came to medication, some people weren't specific on the diabetes medication, which is fine because it's your first time around. But looking at the guidelines again, I think only maybe like four of you was like, yeah, we're going to stick with the metformin because metformin is great. It's the first line drug. You can use it in a GFR of 30 and above. And sometimes a nephrologist will push it. That's not your job to know that. And then also, when would you start insulin, right? That's a good question. In terms of approach for labs, so no one mentioned a urine microalbumin, and a urine, which is really important for someone who's diabetic in general, but also complaining of a fever and not feeling well. Um, polydipsia. We got to check the UA for ketones, for sugar. We got to check the microalbumin for protein in the urine to look for kidney changes. So make sure that that is mentioned. Also, nobody mentioned checking lipids, so that's definitely important too. Um, Again, that's based on the guidelines. So crack open those guidelines. Please do not use websites like Mayo Clinic or I'm trying to think what else, like Cleveland Clinic. Like those are helpful and nice, but they're not the official guidelines, so don't go by them. You need to use scholarly sources, okay? And there's a little piece on the wall that I discuss scholarly sources. And then last but not least on teaching, everyone did a great job on education on the diet and exercise. Not many people talked about blood sugar goals or A1C goals or self-management of diabetes, and that's fine. Or again, you're still learning. So looking at the guidelines again to discuss that. And then nobody talked about wound care or diabetic foot care. So that's also something really important to talk about. I was really proud of you guys with your social histories, your family histories, and a lot of you guys did a great job on the menstrual history. Actually, so I went through and did Miss Jones's assessment on Shadow Health, and I completely skipped her sexual history. And her, I asked about her last pap smear, but I didn't ask about her periods, if they're regular or anything like that. So, good job for those of you who did do that. So again, this is going to just take time, but what I recommend to you guys is each week we're covering a section, and your book tells you really great stuff on what to ask and what to focus on, and take advantage of that. So use a systematic approach for each area of the body. Okay, so for example, I'm a nurse practitioner. So when a patient comes in and talks to me, their chief complaint is a headache. I first of all start with old cards: onset, location, duration, blah, blah, blah. Okay. Then I ask them, have you ever had this type of headache before? Do you have a history of headaches? Have you hit your head? And then I ask about their eyes because, your vision can affect your head. I talk to them about what medications they use, anything over the counter. Where do they work? Are you exposed to fumes that can cause a headache? What's the amount of screen time that you use? Are you sleeping? I ask about stress. I ask about neck pain. I ask about muscle pain. And all of that I get from my book. I have been a nurse practitioner now for 4 years, almost 4.5, right? 2014, 2018, 4 years, I apologize. And I still take out my assessment book. I have it in my office. And my students who come through for me to be their preceptor, I pull it out. I'm like, you guys, this is my best friend. I still use it all the time. So making sure you take advantage of that. And then going through guidelines on the approach of diagnoses and what labs to order and what education and what medications. So I'm really proud of you guys. Shadow Health is definitely tricky to use in the beginning, but then once you start using it, it's really great. I actually was getting really into it. My husband's like, what are you doing? And I'm like, this is better than school. I wish I had this in school. It was great practice. So good job to all of you, and I hope that this video helps.